Hello everyone and welcome back to my second YouTube video. Today's YouTube video is going to be about the bacteria with exotoxins continued. And these are the three bacteria that we're going to go over today. This is E. coli, Bacillus, and Vibrio Cholera. So three of these bacteria increase the fluid secretion. I remember these bacteria as E, B, and V, like Epstein-Barr virus. So E. coli, which is your traveler's diarrhea, Bacillus Anthracis, and Vibrio Cholera. So your traveler's diarrhea uses a heat labile toxin and a heat stabile toxin. Bacillus Anthracis uses edema factor and Vibrio Cholera uses cholera toxin. Now it's very important to remember the toxins that cause a watery diarrhea or an increase in your fluid secretion. We're going to start with E. coli. So we have our traveler's diarrhea, which is your ETEC. It's a gram-negative rod that contains two types of toxins, heat labile toxin and heat stabile toxin. Your heat labile toxin overstimulates cyclic AMP, which increases chloride secretion in the gut and water follows. So you get efflux of water causing watery diarrhea. Heat stabile toxin overstimulates cyclic GMP, which will decrease sodium chloride and water reabsorption, causing watery diarrhea as well. So there's no inflammation or invasion of the gut bacteria. So patients with traveler's diarrhea don't present with fever or shock or any sort of inflammation. There's no treatment for traveler's diarrhea, just oral rehydration with electrolytes and plenty of water. So the way that you can remember what each toxin does is that LAMP is a little shortcut I've come up with. For labile is with AMP, and L comes before S, just like AMP comes before cyclic GMP. Then we got Bacillus anthracis. Anthrax is a gram-positive spore-forming rod. The transmission is that it's found in animals, contaminated soil, or inhalation of sheep wool. Anthrax toxin consists of three types of toxins, which is protective antigen, lethal factor, and edema factor. So that's protective, lethal, and edema factor. It also contains a polypeptide capsule that contains a poly-D-glutamate component. Now, step one likes to ask you about the poly-D-glutamate capsule. On histology, we're going to see halos that are often referred to as a medusa head or a boxcar shaped. And on the next slide, I will show you what that looks like. So if we look at this image, we can see that there's these tiny little boxes attached to one another, and this is diagnostic of anthrax. Now there's two forms of Bacillus anthracis. So we have pulmonary and cutaneous. The pulmonary is known as your wool sorter's disease, where you have inhalation of the spore from infected animals or animal-containing products. This will lead to fever, shock, mediastinitis, and pulmonary hemorrhages. This is because it is due to inhalation. So on chest x-ray, we will see a widened mediastinum. The cutaneous version is a painless necrotic ulcer that's black in color, surrounded by vesicles, and this is due to the edema factor. Now again, the cutaneous they like to ask about a lot, and this is black in color, surrounded by vesicles, which is usually how they would describe it word for word. Now, what's the treatment for anthrax? So treatment is ciprofloxacin, which is a fluoroquinolone. It inhibits topoisomerase 2 and 4, also known as DNA gyrase. Or we can give doxycycline, which is a form of tetracycline that will inhibit your 30S ribosomal subunit. So two treatments for anthrax, ciprofloxacin and doxycycline. Moving on to Vibrio cholera. So cholera has a flagella. It's oxidase positive, a gram-negative curved rod, and it has a flagella like I mentioned, so anytime you see it on histology, you will see a rod with a flagella. It will grow in alkaline media, and it contains cholera toxin. Cholera toxin increases cyclic AMP, which will increase chloride secretion and water efflux, causing a rice water diarrhea. It has a large inoculation dose, and it's acid labile, so the acidity in the stomach will kill the cholera. Therefore, much more is needed in order for it to cause an infection. Now let's look at the histology. We said it's comma-shaped. So looking at this, here's a comma-shaped organism with a flagella. Here's another comma-shaped organism with a flagella. Here's another one, comma-shaped with a flagella. So Vibrio cholera, the transmission is raw shellfish, undercooked food, and the water has been water that has been contaminated with cholera. So Vibrio cholera can be transmitted with raw shellfish, undercooked food, and water that has been contaminated with cholera. And we treat with oral rehydration. And that's the end of your 3 exotoxins that increase fluid secretion. Stay tuned for the next video.